very top, that is when the QRS segments are smaller and there is no P wave, and they're very irregular as well. He also had a right coronary thrombosis, and his EF was 40 to 49%, and he was a 62-year-old male, and he was a moderate exercise level, and his starting stats was his home exercise only included 10 to 15 minutes of walking, and his goal, he was a construction worker, so he really wanted to go back to work was his goal, and he also wanted to lift heavy things, just build strength. His QOL 19, his DHO 9 was a 0, waist circumference was a 44.5, weight 223, MET was a 3.2, BMI 36.1, his stress was a 6 out of 10, and his max MET was a 4.1. He also was a smoker previous to surgery, but stopped immediately after surgery, and so he was in maintenance the duration of his time here. So for his nutrition, once he came, he really kind of took off with his nutrition. He verbalized to me multiple times, like, I want to get better and really work on this, and so he wanted to seek out a nutritionist, started a low-fat, low-sodium diet. He was drinking 3 16-ounce cups of water, started to increase fruit, and he had trouble increasing vegetables in the beginning, and he was drinking no alcohol. So, for the medications, I'm sorry in advance, I really tried to pronounce these as best I can, but, so he was on Tylenol, which is used for pain relief, and then, albuterol, it helps with asthma, and I did some research on how it affects during exercise for all these medications, and they have had some speculations of muscle pain and dizziness with some patients who take it. And then the next one is amitriptyl. Physiological effects is an anti-arrhythmic drug, so it helps with his AFib. And then effects on exercise, lowers heart rates, so that's why I get to watch his heart rate while he's in here. The next one is atotropistatin. It is it lowers cholesterol. The next one is clopidogrel. It's an antiplatelet drug, so it helps keep the blood flowing through the heart. And then side effects are, studies have no major side effects of this drug for exercise. And then the next one is a prescription for, he has gout, which is a form of arthritis. So this medication is a nitrate, so it works by relaxing the wind types of blood vessels, so blood can flow easily through the heart, and it reduces the it says in this study that it can reduce the perceived exertion during exercise. Metoprolol, it's a beta blocker, so it's used to treat angina, and it slows the heart rate, so target heart rates need to be adjusted accordingly. And then nitroglycerin, it's used to treat angina as well, but it's immediate acting. So the vasodilator helps treat episodes of angina. Studies have shown it can increase cardiac output and decrease systolic blood pressure based on the study. And the last one is warfarin. It's a blood thinner as well, so it treats blood clots and it can cause excessive bleeding. So his MET level, it increased in the very beginning, and that spike right there was a max test. It was a 4.1 in the beginning of his duration here, and he kind of leveled off the duration of his time here, and that was because he did have high blood pressure, so we had to really watch his blood pressure as he progressed here in cardiac rehab. So he would rate everything super easy, but we'd have to keep him at a lower level because of his blood pressure. So his ending stats, his max MET went from a 4.1 to a 7.1. And then his MET level he was working in here was a 3.8. was 40 minutes, and then he started home exercising 5 days a week, and he was walking 30 to 60 minutes. His BMI was 37, and his waist circumference was a 43.75. Weight 229. Stress went from a 6 to now a 2. And then patient reports to have felt an increase in strength and endurance, and his daily life activities did get easier at his duration of the time here. His QRL was 19, and PHQ9 was a 4.
Can you go back to the last slide really quick, the graph?
Yeah.
So you say 7.1 is the max, but it's not showing on that graph?
I just forgot to put the top is his end at the very end. His end some excess.
Okay.
Yeah. And nutrition, he started seeing the dietitian bi-weekly, and he maintained a low sodium, low fat diet. His duration here, he decreased his waist circumference since he was here from 45 to 43.7. One thing I did really admire about him was once he got his surgery, he was really wanted to make a life change. So I really admired that about this patient. So I did a little bit of evidence-based, just because I was very curious on. So he wanted to build muscle strength. And I was like, what's the next step for after this? And so pretty much exactly what we talked about in here is what research says is what he should do. So it's pretty much frequencies up to the individual. He's doing 5 days a week, so that's exactly what research indicates. And he's also, same thing with the rate of perceived exertion we do in here for him. It said that 11 to 16 and to get to 85%. And then regarding to resistance training, it said to work major muscle groups 2 to 3 days a week, and with light resistance with an RPE of 11 to 13. Mostly muscle endurance has shown the best benefit for them starting off. And duration, this is just the guidelines that they prescribe for each, or they recommend for each mode of exercise as well. So, patient number 2. He had a myocardial infarction, and he had a percutaneous coronary intervention in his right coronary artery, and he also had type 2 diabetes. So right here is a picture of the incision he got put in his right coronary artery. His EF was 40 to 49. He was 61 years old, and he started off home exercising just by swimming and getting 1,000 steps a day. His goal was to build muscle mass and to eventually be able to go hunting. His quality of life was 19. His PHQ was a 3. Waist circumference was a 26.75. BMI was a 25.4. His weight was 179.2. His MET was a 4.1. His first MX test was a 8.9. So this patient was an advanced exercise level. Nutrition goals, so he lost weight, lost 10 pounds after his heart attack, and so he wanted to gain weight back. He did not really pursue any nutrition changes, or had any really interest in pursuing nutrition changes when he first got here. He just wanted to gain weight. He was drinking 4 cups of coffee. He's eating 3 meals a day, lots of salads, he says, and then he was 1 8-ounce cup a day of water and liquor 3 times a week. And just we educate him on all of those. The medications. This man was on a lot of medications. The first one was atotrostatin. It's a statin that helps regulate cholesterol. The next one is cangolipsin, lowers blood sugars with type 2 diabetics, and it also helps reduce strokes and heart attacks. Some patients have report feeling dizzy during exercise, and lightheadedness may occur. And then clopidogrel, it helps with severe chest pain. Studies have shown no major effects on during exercise. And then coenzyme Q, acts as an antioxidant cells from damage and plays an important role in metabolism. Studies have no major effects on exercise. Eosinopil, ACE inhibitor used to treat high blood pressure. Studies indicate that there's no effect on RPE or performance, but it can increase systolic blood pressure. So, the tropholin helps control high blood pressure. Metoprolol, the beta blocker, is used to treat angina. It slows heart rate, so it's why it's important to make sure we have an appropriate target heart rate for this individual. Nitroglycerin, like the last patient, it's a vasodilator used to treat angina. It's fast acting, and studies have shown no significant effects. So these two medications, so the reason why he lost 10 pounds was because he found out his stomach was not digesting food properly anymore. So they got a prescription for these two medications, and after taking them, he started to gain weight and actually have an appetite again. So those are what those two medications are for. And then pantoprazole used to decrease simvastatin, statins used to decrease the amount of fatty acids, substances, LDL cholesterol, and triglycerides in the blood, and to increase HDL. The last medication, sitagliptin phosphate, helps treat symptoms of type 2 diabetes, and there's been some studies indicating drink. Alright, so as I know it's a little blurry, but I did take this from my textbook. I think it just kind of makes everything clear. It helps me a lot understanding what the medications do and how they affect exercise and the side effects of them. So I just decided to put it in here because I thought it was a really good chart, kind of summarizing it all. So his MET level. So it definitely fluctuated a little bit as he progressed here. That dip right there was because he went on a trip and he came back and he came with a knee injury. So that was kind of him kind of learning how to adjust to exercise with his new knee injury. So that is why it decreased, and then at the end he started recovering better and got used to exercise. His end stats was his max test ended at a 10.4. His max duration was at 32 minutes, and waist circumference was at 37.75. His weight was 180, and stress 5 out of 10. Patient did report feeling an increase in strength and endurance, and daily life activities did get easier as he was here. He did report that he did feel more confident in his abilities in general, and the fear of a heart attack a recurrent heart attack went away as he finished his time here. And he is now a member of the Valley Medical Center fitness center down here, so that is what he's doing now after cardiac rehab. His quality of life is a 12, and his PHQ-9 is a 4. So in nutrition, weight, he gained a pound. He's still drinking one cup, but he did decrease his coffee intake to 2 when it was a 4. Liquor was still 3, but he like I said, that stomach medication that he was taking did help. He started taking the appropriate medications, non-medications, and and his snacks did decrease to more healthier options, protein bar and trail mix, which was cookies and brownies before, and then started balancing meals with protein supplements. So pretty much I was like same thing, like you wanted to build strength, and it's pretty similar to the previous patient. 3 days a week, RPE 11 to 16, large muscle groups, and so like things that we do in here, treadmills, and then bikes, resistance training to start off slow. RPE could be 11 to 14, like the other one before. Again, large muscle groups. So more muscular endurance based. I also did find this really interesting article brief description of it. They did a bunch of case studies, and they just said, just tested all the different fad diets that are happening now, DASH diet, and then a training diet, but also high carbs, low fat, high fat, all this stuff. And pretty much, I found this little slide right here, pretty much a diet recommendation for the what they have and the disease next to it. So I thought it was very interesting. And then my time here. So why did I choose these patients? Well, first, they were very outgoing. The men were two very outgoing men, and they I could tell that they really wanted to get better. And so I really admired they were both very hardworking, so that's why I chose them. What project did I accomplish? So I did the macronutrients board and also the stress management board out back, and I did 2 brochures to go along with them. And then I had all the patients track what they ate in a day and kind of calculated their carbohydrates and fats and things like that, and kind of see where they're lacking. And I gave them the brochure to kind of show them of how much they should ideally be eating at each. And then what did I learn? So I don't even know where to begin of how much I've learned since I've been here. It's definitely something different from I've only been in the classroom setting, and now I am now working in the field. So it was very eye-opening, and I've learned so much regarding just how to interact with patients, how to interact with other colleagues, and also how to be in a professional environment. But also when it comes to like blood pressure averages and like how to prescriptions and all this stuff, it was amazing, and I loved it. And something that I think I brought was I tried to make as easy flow through here as possible. I tried to be as much as a help as I could, and also I did realize as my time here is like a lot of these people don't see other people at this time. So I was like, I need to be as professional, but also like as like warm as I can for these people, because they're very like, I can tell like sometimes they're very hesitant in coming in here in general. So I just want to try to be like as like uplifting, and I really came like maybe like my midway here, I was kind of like, wow, like these people probably don't see other people. Like I gotta like bring it, gotta be as friendly and outgoing as I can, and really make sure that they feel like we want to help them get better too. So, and not be scared during this scary time. So that's something I really tried to work on while I was here as well. And then that's the end of my presentation. And then my references are all here. Any questions?
Yeah, for both cases, what were their risk factors?
The risk factors. So one had a clot, so he a thrombosis, which is a stationary clot, so that was a risk factor, especially since he had high blood pressure. And then the other one also had high blood pressure as well. And his EF, they were both EF were decently, but those are the 2 main risk factors.
Okay, so can you list what all the cardiac risk factors are?
What?
The cardiac risk factors, can you list what those are, and then did the patients have those cardiac risk factors?
I wasn't sure.
Okay.
Yeah, I didn't look at those.
Anybody else have questions?
I'm curious about the diets, that review that you looked through.
Yeah, this one right here?
Yes, go back one more slide.
Yes.
I just wanted to read the rest of it.
Oh, okay, yeah.
So how would you recommend knowing these people and what their exercise level is, what they're capable of doing? How would you recommend they progress their personal exercise, their home exercise?
Okay, so for the one that had a myocardial, the one that had a heart attack, so he he progressed very well. The one thing that I would like keep in caution is like he did have that knee injury, and it was pretty like severe. Like he couldn't really he was on the like he did the like elliptical for a while, but then he couldn't even do like the bike. So definitely babying the knee, but also like still working on trying to strengthen the muscles around the knee through like the resistance training, but more of like free weights was recommended if you wanted to build strength but more muscular endurance. Still maintaining, probably doing like the like he said the treadmill didn't hurt, but still trying to maybe add like incline to still get the heart rate up and things like that. That's probably how I progressed him. And then for the person that had cabbage would be to make sure he's still staying in that heart rate range, and to add the like an incline to his progression, because he said he's just walking on a track. So by adding a little bit more of a incline could help build his stamina a little bit and build his strength a little bit. So like maybe on a treadmill. But if you wanted to do like resistance training, like free weights or like bands, something like, or body weight, just very little and kind of progress slowly. That's probably how I do both of those. Any questions? Any other questions?
So we like to guess who your patients were.
Okay.
So we just have time to
You can
think.
pause the video.